Do you have experience in building blocks? We are built like this. So if we give slight force, it will fall down. Like that, our vertebrae are like this only. So if it is fall down, what happens? Myself Sukumar, I am the student of occupational therapy. Spondylolisthesis is a medical condition in which one vertebra is forwardly translated on another vertebra. In spondylolisthesis, what is happening? Spondyle means spine, listhesis means breaking. So lysis means breaking, right? So if the bone is translated in front like this, so then posterior part is called spine. So that spine you can remember as a spinous process. So spinous process is breaking down. So due to this breakage, there is a forward translation, or due to forward translation, there may be a breaking of the spinous process. So what is forward translation? If I am stand like this, so my vertebral body are placed like this. So vertebral body is anterior part. Superior vertebra is slightly forward translated like this. So this is the spondylolisthesis. This shift commonly occurs between L4 and L5 vertebra, or else L5 and sacrum vertebra. Normally, disc is the cartilage between the superior and inferior vertebrae. So normal disc, lamina and facets are protecting the vertebra from its translation. So if they are normal, the spine is normal. If there is a lack in these, so then there may be a chance to get spondylolisthesis is caused by many factors, but mostly degeneration is a common factor. Wills and Newman classified the spondylolisthesis. First type is dysplastic. We know dysplasia means abnormal cell growth. In our spine, there may be a chance of getting the bony projections, though. So this leads to spondylolisthesis. It's called dysplastic. And lytic. What is lytic means breakdown. There may be a chance of fracture in the spine, so that lead to the spondylolisthesis. Is a second classification. Third classification, degenerative. So there may be a chance of degeneration of the disc, facet or the lamina. So it leads to the disalignment and it leads to forward translation of the vertebra. And traumatic, during an injury. So forceful injury, the vertebra is slightly forward like this. So it is the traumatic spondylolisthesis. And pathologic. So the person having tuberculosis or any other condition which affect the bone. So that pathology leads to the spondylolisthesis. That is called pathologic spondylolisthesis. So one other classification, it's not comes under the Wills-Newman classification. It is a other classification that is called laterogenic spondylolisthesis. In laterogenic, what is happening? So we know our disc in front of the vertebra, there is a small attaching part called pars. It is placed in the articular facet. So two vertebrae are connected in the articular facet. In the articular facet, these pairs are present. So PA or pairs are present. In laterogenic spondylolisthesis, these pairs are fractured due to decompression means. So the spine is lengthened like this, and it decompression leads to pairs fracture. So this also leads to the spondylolisthesis. In all these conditions, spondylolisthesis means the superior vertebra is translated forwardly on the inferior vertebra. So like this. What are all the clinical features? So clinical feature is the signs and symptoms. So there always spondylolisthesis happening in the L4, L5 or sacrum region. So there may be a chance of getting severe back pain, low back pain in this area. So don't think there may be a chance of the nerve compression and they have paralysis, that are not happening. So neurological deficit is rare. Dysplastic spondylolisthesis may be comes for the congenital. So or else, so for child it may be come. So we have to notice the symptoms. So if we palpate in their low back, we can palpate the step-like structure. So by this we can suspect and diagnose by using X-ray or any other scans. For these children, hamstring tightness is present. So if the hamstring is tight, so logically think hamstring is tight, then what is happening? Knee is flexed. Obviously hamstring is tight, then it is responsible for the knee flexion. So knee is flexed. Then degenerative spondylolisthesis is for the middle-aged people. So they have severe pain. So degeneration is not happening by birth. So it should be happen in the middle age. So if they have a degeneration and having the spondylolisthesis, it make a severe pain in the low back region and radicular pain in the nerve root. They may have pain. So the person used to walk 4 kilometers previously, then his walking distance is reduced. It is also a symptom. If the 4-kilometer walking person walk only 2 kilometers and having pain, then he may be suspected to having the degenerative spondylolisthesis. We can easily diagnose the spondylolisthesis in X-ray itself. So if there is a damage to the soft tissue, we can take MRI scan, CT scan. Dysplastic spondylolisthesis comes early, so it have the neurological complication. So risk of getting neurological complications. If the diagnosis is dysplastic, it may be progressive. So if the progression is confirmed, then we have to do surgery as early as possible to prevent the neurological complication. So dysplastic is very progressive. Then compared to the degeneration is a very slow process. So it is not much more progressive like dysplastic. How we treat spondylolisthesis? First, conservative treatment. So it is a symptom management. So if the person having back pain, then we have to give bed rest and activity restriction. They are restricted to do some activity like flexing, trunk flexing activities, and they are medicated as analgesics. So pain medications are given. Braces are used for this persons. So braces is a orthosic substance used to maintain the alignment of the bone. Then operative treatment. In this, the spondylolisthesis affecting his day-to-day life and interferes significantly, so they can't do anything like that. So for these people, or neurologically they are affected, their nerve compression is present. That like surgery is important. That is operative treatment. In surgery, the fusion is established. If the fusion is established, the translation is returned to the original position. Okay, dears, I believe you are aware about what is spondylolisthesis. The spinous process is breakdown, that is a spondylolisthesis. I believe what are all the information given by me is useful for you. Thanks for watching. Be proud to watch this video. I also need support, so please subscribe.